James Parkinson publishes an essay, The Shaking Palsy. James Parkinson was born in 1755 in England. He was an established surgeon, apothecary, geologist, paleontologist, and political activist. He was an advocate for the underprivileged and outspoken, a supporter of the French Revolution, and a member of several political societies outside of his medical career. Some of his medical accomplishments include publishing literature on gout in 1805, which is an inflammatory arthritis caused by a buildup of uric acid, documented the first appendicitis in 1812 and linked it to a fatality, and what we will be discussing today is his discovery of the shaking palsy, later renamed as Parkinson's disease. His observations were based off of 6 people with tremors, 3 of which whom were his patients and 3 of which he observed on the street walking around. He differentiated between resting tremors and tremors associated with movement, which also allowed him to differentiate the disease from MS. Although he correctly labeled Parkinson's disease with tremors and an inability to move, he incorrectly proposed that the disease was caused by problems in the cervical spinal cord. Dr. Parkinson treated his shaking palsy disease via bloodletting from the neck and blistering the skin to create drainage. Both of these techniques were used to release pressure from the spinal cord and brain, which we now know is not how you treat Parkinson's. Other ways to treat Parkinson's were suspension device that was used to stretch out the spine. Ablation was used in the early 1900s, and we didn't have an effective treatment until the mid-20th century when levodopa was made for commercial use. Today we know that Parkinson's symptoms include tremors, rigid muscles, slowed movement, impaired posture and balance, loss of automatic movements, and speech changes. The causes of Parkinson's are a deterioration of neurons responsible for dopamine production, which lead to a dopamine deficiency. It can be caused by both genetic and environmental factors, and an early indicator can be Lewy bodies that contain high amounts of alpha-nuclein in the brain, which cannot be broken down. Treatment. The most effective treatment we have today is L-Dopa, which artificially increases dopamine levels in the brain. Exercise and physical therapy can also be used to combat the onset of symptoms. We currently do not have a cure, and there is no definitive preventative measures for Parkinson's disease. Thank you.